So this is called the CardioMEMS device, and it is about as big as my fingernail, and it has two antennas on the end of it. It fits inside a catheter, and the catheter can then be advanced up into the heart. And this particular device is then released into the heart and goes into the right side of the heart and becomes a part of the heart. It measures pressure in the right side of the heart and can send that pressure to a receiver that's outside of the body, and that receiver can send that wave via the internet to a doctor's office, so that if you have heart failure, and heart failure is caused by the pressure in the heart getting too high and that pressure backing up into the lungs, and the water basically going into the lungs and making you short of breath. That's what produces heart failure. This device tells us that the pressure is rising. That happens before you get short of breath, before you feel badly, before you need to go to the hospital again. So therefore the doctor can see that your pressure is rising. He can call you and tell you that you should change the dose of one of your medicines and prevent you from getting admitted to the hospital again. And this has been studied, and in fact it reduces the readmission rate to the hospital by 37%. So about a third of patients who would be admitted don't get admitted because their medicine is adjusted in their kitchen rather than in the emergency department. So it's a real advance forward, and this is available here at Hackensack. You go and see your doctor in the office, and they can do a physical exam and try and hear the sounds of fluid in the lungs. But that's a much later sign. That's maybe a day or two later, and you're already feeling symptoms. Whereas with this, before you develop your shortness of breath, your pressure goes up, we give you additional diuretic or another type of medicine for heart failure, and you never get there. You never develop that. So it's a real step forward. It's a real advantage. And it's brand new, just came out within a few months ago. Cardiologists know other cardiologists, and they know what is available. They routinely go to professional meetings, and so if you see a cardiologist, they may not particularly do a certain procedure, perhaps in their hospital. They might not do a TAVR, they might not do a Watchman procedure, but they know a cardiologist and a medical center that does do it, and they can refer the patient to that center or transfer them if they're an inpatient in the hospital. So it's a very good system, and the United States, I believe, has the best medical care in the world, particularly when it comes to advanced medicine. And so my advice to people would be, go see your cardiologist, and they'll decide what's best as the next step. Speak for myself, it's wonderful being a doctor. I enjoy it. I enjoy taking care of people. The fact of the matter is that medicine is much more complicated than it was 30, 50 years ago. And you need to know a lot more. There's a lot more technology. I think that once electronic capability becomes somewhat more user-friendly, that we'll be able to digest some of this knowledge and the paperwork that you're talking about much better. So I'm a real believer in the electronic medical record. I think it will make a big difference, but it's also true that the amount of knowledge that you need to have has gone up exponentially. And you have to really read constantly. I mean, you have to be aware of, we used to go to a couple of meetings a year. Now, you're really, every week something new is happening. And of course, you have to separate out the things that are new, that are advances, and the things that are new that are not significantly different from what you're doing already. So I think it's a challenge. I think at the same time that it's also very enjoyable.